I'm joined today by a doctor of functional neurology. It's a new and cutting edge healing science that's used to heal dysfunction in our bodies and in our minds and really just help us to live and perform at our best. And it's already being used by professional athletes in hockey, football, and basketball, and even by Navy SEALs. And so in this episode, we dive into what it is and how it can help you. Plus, we touch on why people from divorced families struggle more in relationships from a bit of a scientific point of view. We also discuss why a one-size-fits-all approach to healing just doesn't work. It really needs to be personalized and customized to each person. And my guest also shares three amazing stories of people who've benefited a ton from functional neurology, including a boy who was actually confined to a wheelchair that was then able to walk thanks to the therapy. Really good stuff. Stay with us. Welcome to the Restored Podcast, helping you heal and grow from the trauma of your parents' divorce, separation, or broken family so you can break the cycle. I'm your host, Joey Ponarelli. This is episode 127. We're so thrilled that so many of you found the podcast helpful and even healing. We've heard awesome stories, awesome feedback. One listener said this: I love your podcast. I listened to one of the episodes today and found it very engaging and professional. I sent a link to the podcast to people I know who need it. Thanks again for the amazing work you are doing. Again, we're so happy to hear that it's been helpful and even healing. We do it for you. Today's episode is sponsored by Blackstone Films. In a recent survey by Adobe, 98% of Gen Z and 91% of millennials said video is their top content choice. And that's not really surprising, but if you run a business or a ministry, are you taking advantage of that? Are you using video content, especially in your marketing? If you're like most of us, you know you need to create video content, but you don't really know where to start. And it can leave you feeling kind of overwhelmed to the point where you just give up on video and you just go back to what you know, with what's comfortable, even though it might not be best for your business or your ministry. But that's where Blackstone Films can help you. They're a Catholic film and video production company that creates films that make you feel. They can create trailers, promo videos and commercials, social media videos, documentaries, fundraising videos, and even courses. We actually produced 2 video courses with them. We had an awesome experience. And so whatever it is that you need, Blackstone is obsessed about not just helping you create the video content itself, but create a clear win for you and for your business or your ministry, such as fundraising for your ministry, selling a course, getting leads for your business, getting students to sign up for your school, promoting your event, and so much more. And Blackstone has literally reached millions of people around the globe with their videos, and they can help you too. And so if you want to view past projects and the services that they offer, or maybe just contact them, go to blackstonefilms.co, not .com, again, blackstonefilms.co, or just click the link in the show notes. My guest today is Dr. Paul Link. He's a functional neurologist and director of clinical education at NeuroSync, as well as a staff clinician at St. Joseph's Chiropractic in Steubenville, Ohio, and Sero, S-E-R-O, in Canada. He has published over 100 papers and case studies in neurology, ranging from concussion, ADHD, mood disorders, and various genetic conditions. He applies an approach of without drugs and surgery to neurology and wellness by using eye movements and other neurologic pathways to assist in brain health and healing. Really fascinating conversation. Here's my conversation with Dr. Paul. Dr. Paul, welcome to the show. It's so good to have you. I'm really excited for this conversation.
Yeah, when you reached out, realizing doing a lot of work on your background and looking into it, I realized this is not only incredible, but it's an incredible opportunity for me to not just spread the word on functional neurology, but get a chance to learn from another patient demographic and population I've been working a lot with. So I think it's going to be great from both ends.
I appreciate that. And I've heard a little bit about functional neurology. I know I mentioned to you that a couple of siblings of mine have been through some functional neurology treatment for some injuries, but also just kind of general health. And I am really intrigued by what they've told me so far, but I really don't know a lot about it. So I'm going to be learning alongside our audience through this conversation, which I'm excited about. So starting out, we have this audience of people who come from broken families, whether it's just a lot of dysfunction at home or their parents, maybe are divorced. And so I'm curious, why should they care about what we're about to talk about?
When it comes to functional neurology, I think one of the best ways to look at it is not just that it applies solely to those who are sick or are going through different avenues of health abnormalities or anything, because one of the things that makes functional neurology unique and what it is in general is if you can imagine living in the gray zone. A lot of the most medical community, when everything is it's black or it's white, you pass this test or you didn't, and nothing more than that. I mean, there's plenty of times you go for health screenings, you're doing lab work, and everything is showing up. It's either good or it's out of range, and nothing in between. If you can imagine functional neurology and this sort of triage we've been able to create with our colleagues and everything in our clinics, is that we're taking that gray area and making that applicable to the masses. So you don't necessarily have to have had a recent concussion or a patient with autism. I mean, the subset of population you could reach is honestly infinite. I mean, we've seen people, and I've been fortunate to see people over the years, from Olympic athletes, you name the professional champion, the celebrity world preparing for movie roles, all the way down to even just, Fortune 500 CEOs or average Joe in business who just realizes that there's little finite things that's making their day-to-day off. And that could cost the company millions of dollars, or that could cost them their contract year and their final year of play, all the way down to this could be a major driving point from them to go from maybe in a wheelchair to having their own control of their activities of daily living. So there's no avenue that it can't reach to. And it's really just taking those little fine tunings. And once you understand the neurology and how to apply it, whatever patient's in front of you, you could start clean slate and just kind of direct care as you need be, and pulling from a lot of other professions. And that's kind of what makes it unique, is that it really is that combination between PT, OT, athletic training, classic neurology. It's taking all these avenues and just, like a Venn diagram, placing the overlap and just pulling the tools that you need.
So good. I've been thinking more lately about this whole idea of kind of like psychological drag, or just drag in life, meaning, you imagine if you're trying to run fast, you can run fast, in a lot of scenarios, except if you have like an injury, or maybe you're running and you have a parachute on your back and you're trying to run really fast, but you're not really getting anywhere. To me, it almost seems like in life when there's all this like untreated trauma on the emotional end, or maybe some physiological, problems that we're just overlooking or ignoring, it creates that drag in our life. So we want to run fast. We want to get up the mountain. We want to, do all these things. And yet we have all these problems that are holding us back. And so I think I'm so glad we're having this conversation, because I think healing can't just be one-sided too. It needs to be multidimensional. And that's what I hear that you guys do in your profession, which is amazing. So I'm sure you have so much to say to that. I wanted to, and we'll dive deeper into all this, but I wanted to just kind of start with the definition, like what is functional neurology and why did you in particular get into it?
Yeah, so functional neurology is that application between taking the classic neurology and it's really applying that without drugs and surgery. So you're applying neurology by looking at the 5 to 6 senses you have, not the sixth sense like one of the very good movies with Haley Joel, but you're looking at the sixth sense, we'll call it the vestibular system, right? So you're just taking your visual system, your hearing, your sensation to touch, smell, right? You're taking these systems and you're just understanding how they really enter the brain and then what the outputs are of them from there. So you're looking at the bedside and you're looking at, one of the things that we utilize the most of is eye movements, because if you're talking about, the eyes are the window of the soul, they're the window to the brain. So you're going to get majority of your information that's going to keep you alive based off your visual information. And from there, you can utilize, and we're not looking at what you'd have from an optometrist or an ophthalmologist, but rather we're looking at those fine motor movements. What are the fine tunings that make this eye movement in particular intricate? And then every little defect or deficiency in there tells us that an area of the brain is not working so well. So you're just taking the senses and you're taking those classical bedside examinations from, okay, touch my finger, touch your nose. And you're not just saying, okay, yes, they check those boxes, but we're looking at a little bit more fine tuned to say, well, did they touch it with the fingertip? Was there a little bit of a tremor? Was it smooth? Did they miss? Was one area a little bit faster or slower? Because every one of those little deficiencies or inadequacies is going to tell you a lot about what's going on in the brain. And then you're just taking those areas and understanding where in the brain it's working well and which areas aren't. And now how does that apply to that individual's needs? Are they the hockey player that's trying to get ready for the game, or are they, Joe the accountant who's having difficulty because all of a sudden he's realizing that he's carrying numbers over in the wrong way? And you can find any little flaw in these areas of the pathways and apply to it. As much as they're so far off that they're trying to get back to work of their life, or they're already that super high functional athlete who's trying to do it in performance enhancement. And actually, kind of what you talked about before, which is funny because it's similar enough, is I've always described it as like, imagine you're running. You're going to run a 40-yard dash, and you're running. Your time is whatever, 5 seconds. Now take the same thing and take those goggles from the DARE program and put them on. You're going every which way. You're off in traffic. You're falling, stumbling. It's the same area. If your brain, because the three main jobs is to take the world in, process it, and respond to it. If there's deficiencies in any one of those, then anything you do is just a consequence of an area of the brain not working so well. Some of those could be heart arrhythmias. They could be increased or decreased hormone production, balance issues, any and everything, reading problems. I mean, there is no deficiency that you can't look at least by analyzing the brain and getting a pretty darn good jumpstart to what's going on.
Fascinating. I'm so excited to learn more and to get into kind of the nitty gritty practicals of the day to day and how you'd treat someone. We'll get to that. But I am curious about the difference between maybe traditional neurology, which I think a lot of people will think of when they hear, the word neurology. So how does maybe your training and your experience differ from a traditional neurologist?
Yeah. So, and I know one thing, Jasper, was where did my background come from? So if you look at traditional neurology, majority of traditional neurology, and it's certainly not a knock on the system, but majority of traditional neurology is understanding and looking at things through certain imaging. It could be CT, MRI, and trying to find those certain flaws. But you have to realize in majority of traditional neurology, their job is to make sure that you are going to be alive. As long as you are without traumas and everything is going to be fine from that application, that is pretty darn efficient and sufficient for that time. Functional neurology is really dealing in the finite and getting you back to your highest health state. And my background from there came similar enough, but honestly by somewhat of a mistake. I was in school. I went to college, interestingly, to bowl and golf, but I went there. So my background is biology and analytical chemistry. And then from there, I was fortunate enough to work on some of the early beginnings of the Human Genome Project and some mice studies with different strains with autism and some of the original BTBR strains. And this one has some corpus callosum difficulties and lesions. So I was fortunate to come out of that world. And in the beginnings of the Human Genome Project, everyone felt like if we could get an understanding of certain allele structures and we can get an idea of the code and we could program out and figure out what areas of this is making a particular protein abnormality that's causing someone to have Parkinson's, or if we find the autism gene, we're going to really be able to turn the world. And very early on, they realized that it doesn't work so easily that way, and it's going to be much more difficult to get that. And we also realized early on, I was fortunate to have some very good guidance in the beginning. And one of the professors had said, if you right now you have no financial obligations, you have no reason to be here, you're a junior in college, I think some of the answers are going to be in neurology. There's a course coming up. It was neurophysiology of pain. If you like that course, I think maybe neurology would be for you and head the route of med school. So did it, took that course. My background was not whatsoever in neurology or anatomy. My mom's a nurse, dad's a mortician, so I was around health from every avenues, and that's kind of where I did majority of my schoolwork and studying, was just sitting in a doctor's office. And so I saw it from the big picture, but I'd never been around a neurologist. Our town didn't have one, so to me that was an unrouted area. So all I did was just take that course and realized this makes a whole lot of sense to me. Applied, was getting ready to go for an MD PhD, and about a month before school, I was working at a golf course where I did for about 10 years, mowing fairways and everything. And I took a little break in like the early days of YouTube back, and it was just like cats playing on the piano. And I went on there and found a video that we had watched in school about this little girl. She was on Oprah and she had allodynia. And I thought, well, let me rewatch that video. That was really interesting. Let me see if I can just spend my time reading a little bit here while I'm waiting. and came across a video of Dr. Carrick when he was doing his Connie Chung interview, and realized, whatever he's doing, I don't know anything about his background, but whatever he's doing, this is the route I want to go. And found out he was a chiropractor, and then I thought that's what I need to do. And about an hour later, I emailed the school and said I'm not coming, and took a few months off and waited for the next course to come through, and went the route to be a chiropractor as a base, and then went and took courses for the Carrick Institute, and realized later on Dr. Carrick was so much more. He was, never to step over that. He was the founding father of functional neurology and created everything from the ground up, and just an absolute brilliant mind that gave us all a tremendous foundation to build upon. And I was fortunate later on to go work for him and Dr. Antonucci at Plasticity, and have a great background. That the first patients I saw, and really the only cases I saw, were ones that had been 10, 12 different places, and had been to, you name the clinic, and didn't get the results they wanted. So it made some of the work a little bit more difficult, but in a way it gave a lot of avenues that we realized there's so many areas over here that these patients are going through very common diagnoses, or at least different types of diagnostic procedures, but they're missing a very large picture that's giving a lot of our answers. So we were able to just super specialize into that. And I was very fortunate that, my first job right out of school, actually while I was in school, was just being around, some of the most brilliant minds in neurology, and allowed me to, publish a lot of papers and research. But that gave me a very quick education into the application of neurology right from the textbook that you don't see. So that's where my background came out of. It was really more than from genetics right to neurology, and then just really seeing the overlap from the cellular level. So it also kind of also demonstrates that there is no avenue that you can't go into.
Wow, what a story. And I'm so grateful for people like you and the doctors you studied with. And I saw that you've done a ton of research on this as well. Like you've published so many papers, things like that too. So it's just so fascinating. And what a privilege too, to just be at the forefront of this kind of new field of study, and the way in which you're helping people. So my goodness, I'm honored to talk with you. I wanted to maybe paint a little bit of a clearer picture on top of what you've already explained about kind of what parts of the body functional neurology focuses on. You already mentioned the senses and the sixth sense, like you said. Take us a little bit deeper there.
Yeah, so if you can imagine, we talked about it a little bit. There's no limitations to neurology, but imagine a situation where, let's say, an individual is going through, they're about to do some public speaking, and you're about to give that speech, or you're about to hit that golf ball, whatever it might be, and then the heart rate starts going. Nothing in your environment is necessarily abnormal. You could be around people that you're completely comfortable with, but just an interpretation of settings around you allowed for different little intricacies in that autonomic nervous system, that now the heart rate's going, you start to get pupil sweat, and then performance can lack. Some people will develop certain stutters. Some people will, the golf swing change. All these little intricacies that could occur are motor responses because of a poor interpretation of an environment. Or you can look at also the emotional system, how it plays a role. Because one of the ways that we look at it is, if you can imagine the emotional system being treated just like a motor pathway, no different than if I were to reach out and shake your hand, and you would say, okay, well, I'd want to reach my hand out and extend it, grasp and then release and pull back. You would just look at that and realize the systems that were involved in the frontal lobe and some of the areas in the back part of our brain, our cerebellum, to navigate that and make sure it was nice and smooth and rhythmic. Well, that same type of process is occurring, but in this case, the motor pathway is a limbic response: happiness, sadness, fear, anxiety. It's, although a little bit different, very, very similar in terms of its application. So you can have people who, they're getting these different arrhythmias, or you look at people who have POTS is a great example, postural orthostatic tachycardia syndrome, where their heart rate increases or decreases based upon perception of gravity. So now you can see the little intricacies where the vestibular system, the areas in your inner ear, how they have a direct influence to postural responses. Because if you were to be laying down, you would imagine that would be a relaxed state and your heart rate would respond as such. But if you were going to sit up and be involved in an activity, you can imagine you'd want to have a blood pressure and heart rate and rhythm that would match that. Well, if these areas of the brain or brainstem are not responding to the environment appropriately, then any output you could have is going to have these aberrancies. And that's why we can look at almost everything, regardless if a person has Parkinson's, concussion, had trauma in the past. And we've, prior to me becoming a functional neurologist long before, and actually then recent, I've been fortunate, some of my other current jobs working with the Navy SEALs and the Rangers and a few other components of the military, where we can look at these people and not only are they utilizing functional neurology for their return to play or their return to battle, but they're also looking at it as how can we get them after they retire, after they're discharged, how can we get them back into being those, functional members of society? Because, we hear, unfortunately, the trauma and the horror stories of, our vets, they go out and represent and serve our country so well, but then they come back and we have these emotional distresses that we can put them in the correct environment. Everything could be in comfort and they're back home, yet we still have these aberrancies in response. We realize some of it's not just the environment, but we have to be able to access these deeper, older parts of our brain that are survival driven. So again, you can realize that there's no areas that you can't serve, but because of that, if we're just looking at those little intricacies, you could see that you can have someone that looks like a cardiovascular problem, or it mimics changes in we've seen changes in pregnancy rates. We've seen people with changes of different hormone outputs, increased testosterone or estrogen levels that are, and certainly not in all cases, but they are, some of them, brain driven responses. And you address these areas of the brain and the successes are right there. And then when you have, which we're fortunate in our clinic in Ohio to combine, where we say if we take functional neurology with functional medicine and trauma therapy and you combine this triad, I mean, you have an incredible response where now you're addressing everything from not only the neurologic, but the metabolic and a direct input in the limbic system. And I mean, it's just home run time and time again.
So good. No, I love the holistic approach. And I think so many people would agree that I hope one day it's everyone would agree that so much of our medical system is just so like segmented and siloed, and we don't look at the human body, the human person, like through this holistic lens. And that's what I hear you saying, which is like so, so good. And it's so wise too. It makes sense that the work that you're doing would be so effective because it's not just looking at an individual symptom and being like, well, it must be this because of this and this, but it's like really saying, well, what else is going on? So I just love the holistic approach.
I mean, an example you hear talk about like in the orthopedic world and PT and OT, where they talk like the kinetic change. Someone has a knee issue, but it could be coming from the hip or the low back or the ankle. It's really, in theory, just neurology's kinetic chain application. It is those avenues, because we could see it time and time again where, I'm a big sports fan and I've said a game a couple of weeks ago, won't say which team, but probably easy to find. Watched one of my big MVPs drop down with a knee injury. And was that a knee problem? Or was that from different areas of the ankle? A big football fan. Fortunate to work with some of the leagues and teams, but watch some of the players that are on my beloved team, which probably if you look around close enough, you'll be able to find out where they have some soft tissue injuries and they've been dealing with these for their whole career. And you look and realize, is it a soft tissue issue, which it could be, or if we addressed all these areas in the gym and we're still having these soft tissue complaints, is it a neurologic response that we aren't getting the information to the muscles in time and then the output is delayed? No different than we talked about those dare goggles before. What if an individual feels as though they're tilted this position? And if you were to walk around like this all day, you would certainly have contraction of muscles over here because you'd be trying to pull yourself up all day long. So if you were going around because you had a perceived portion of gravity where you felt like you were leaning to the right, as an example, all of a sudden you're going to have not only shortened muscles on that right side and elongated ones on the left, but you'd also have a lot of reflexogenic responses all day long trying to pull you left, even though you are up and down. You're perceiving it opposite. So every response you make would be different. At which point now we're having these pulls and these tears of hamstrings and everything left and right in the league because we're looking at things sometimes solely from a soft tissue response. But if we put someone on these balance plates and we looked at centers of pressure and we combine that with our analysis of eye movements, we can get a better perception as to where does this person feel like they are in space and where space is around them. Now we can get a better application as to what they should be responding to. And now some of the injury prevention can look a whole lot different. And it's not just, again, in the sports world, but that's in everyday life. If you perceive a new relationship as being tarnished for whatever reason because it resembles someone you knew before, that's not giving a fresh, clean slate to this new person. But if we can allow these areas of the brain to have a better interpretation of what's the current environment and be allowed to interpret your settings in a much different way, some of these responses of PTSD or trauma responses from adoption and everything like that, we can solve these a lot quicker, or at least help them along where we're still using traditional therapy responses, but because we're addressing the areas of the brain in conjunction with that or prior to, now these traditional therapies of the talk therapy or the nutritional therapies and functional medicine, because the brain is actually healthy and these tissues are able to respond appropriately, now the successes from those other avenues that the patient tried before that it couldn't quite stick, now they're having the success that they didn't have before, all because you just addressed the areas of the brain that were really of concern that weren't looked at. Because it is taught in school, unfortunately, very compartmentalized. Okay, this is the knee, this is the temporal, this. Well, how do they work together? Don't worry about that. You just refer them out to somebody else. The knee guy will look at that. Well, am I ever going to talk to the knee guy? No. In fact, the patient's not going to see the knee guy for a year. So by the time they go there, they've got other issues, and now we're lost in the system. But if we're looking at it from that holistic, and we're looking at it from that connected approach, now you're addressing things from the source right away, and we're not worried about the knee. We're looking at what the source is, and the knee's going to take care of itself, unless there is a knee issue as well. And now we're dealing with that in the end versus just starting there and hoping and praying we get to the right area. And the guesswork's gone. You're making the invisible visible.
Wow, so good. You made me think of a switch the US Navy made somewhat recently. I remember hearing that on some of their smaller boats, they would have all these specialists on the boats who were just very focused on like one area, like the
Yeah.
engineering or, whatever other areas. I don't know the Navy. And the switch that they made is they made the teams on these boats more generalists, where they were able to do different things and they weren't maybe so honed in or siloed or compartmentalized, like you said, in one area. And it's been like a game changer apparently for them. And so some of what I hear you saying is like, certainly you like have such an expertise in this, but in a way, in the right way, you're like more of a generalist. You're looking at the whole system. You're looking at it without, just focusing on one system, not knowing anything about the rest, it makes so much sense to me. And it's awesome to hear that you've worked with special operators and with pro athletes, because I just think it speaks to the credibility and how effective this is. Because what I've seen too, especially in like the medical world or the performance world, the best and most cutting edge things often start there before they get to the general population, because those are the people who like they want to be at their very best, whether it's Olympians or pro athletes or people performing at a high level. And so it's cool to see how it's going to be spread far and wide, but that you're starting with that group of people. That's a really good sign for everyone listening. You want to know something about this. So much there. Did have a question for you. I was listening to Jordan Peterson the other day, and he was talking about Gottman, Dr. John Gottman's research, and he was talking about how Gottman would bring couples. To anyone who's not aware, Gottman has studied marriage and especially conflict within marriage for over 30 years now, and supposedly they can predict with like 94% accuracy whether a couple is going to get divorced or not just by observing how they handle conflict. And we've gone into this a bit in other episodes, but one of the things that Peterson made me want to ask you was that when they're looking at like how their body responds on a biological, neurobiological level, they're seeing that they're in these couples where conflict is handled poorly, where they follow like the four horsemen of the apocalypse, their body's literally reacting as if there's a predator present. That's what he said. So could you break that down for us? I'm so fascinated by that.
Yeah, without naming too many of my exes, well, we can go through that. But it's interesting because you look at some of those areas with with his research. And then there's even some of his other colleagues and people he learned from or looked at it were type A personalities, or this is an alpha versus a beta. Maybe we do need always the pack leader, and thus the next person in the relationship has to by default be that next personality type or type B. And it's not necessarily that way, but again, if you could look at it from a few different ways, if you can imagine, and it's not like this in all cases, and it is very individualized, but one of the things that occurs in this was if one of the things you're trying to do, and no matter what, and one of the ways that I just do it, it's just easier for me if I look at it, because neurology is certainly complicated, and there's dozens of books over there about it, but in the end, it is complicated. There's a lot of, tiny, intricate names of these nuclei, and it's Latin. This guy's French over here. There's a lot of those areas, and you're trying to figure out that compartmentalized system. But if you just imagine and you take almost that, you're on the island approach by yourself, or you're in the middle of the woods, and you think, okay, if I was to survive this, what would be the adaptations I would make? How would I evolve to whatever the surroundings are around me? But if a person in the area, in certain areas of their brain, and some of these back areas of the brain, these higher areas in the brainstem, that give you a good sense of where you are in the world and where the world is around you, and it combines a lot of things: memories, both short and long term, facial recognition, your posture and balance. Because again, if you're like, I trust you, but let's say I interpret you as a super strong individual, I don't mind maybe walking too close to the cliff because he'll save me. But if I'm with someone who's super tiny, and I think, man, if I jump here, he can't grab me. All of a sudden your interpretation of the same person, but now exposed in a much different sense, maybe is not so good. Maybe you move to an area where you think, my partner here, this is good. We're compatible, until all of a sudden someone breaks into the home, and now you're having the argument who sleeps closer to the door frame, right? Who gets the other side of the bed. It's just taking the environment and allowing these little intricate changes. But if these areas in the brain are either causing anxiety, where you only analyze the negatives of the situations, then sometimes you only view your partner in, can they only help me in the negatives? But from the other way too, if you only analyze things in the positive sense, you're kind of dumbfounded when things don't go a certain way. And it's that way in these relationships and these analytics, where if these areas of the brain are not working well, that are giving you a good timestamp to the current present, and being able to remove that and say, look, that unfortunate thing that happened to me 10 years ago, it's always going to be with me, because that is a survival component that you carry over. But that wasn't this person. They still get the clean slate. And then we're going to use those things, because if we see the comparisons, those red flags, then we have those conversations. But if everything is automatically, everybody with brown hair is the devil, then those types of things are not going to really carry over going forward. That's going to give you success in life.
Mm.
But if you're looking at them, because we can look at these areas of the brain through a vast number of diagnostic criteria and everything, now we can get a better picture as to what's going on in this person's brain. What are the responses? Because we're not just looking at it from those areas of the brain, but also downstream. We're measuring the autonomics. We're looking at, the blood pressure and heart rate bilaterally. We're putting them in different postures. We're exposing them to different environments. We don't expose them to 500 people to understand how they respond, but we need to at least tax the system to figure out, if we know what's going on in this person's brain, and then they're telling us because they're in front of us now and giving us this idea of how it's affecting them in negatively, we can really design a direct game plan for them, unique to everything else, customized for them, that gives them a very, very high success probability that we can solve these things, or at least give them much better tools and direction that their life is successful.
Love that. And I love the customized approach. That was something I don't think I realized coming into this interview, how customized it is. And that makes a lot of sense, how it's hard to maybe give, perfect general answers. But once you understand the specifics of someone's situation, you're able to really dig into that and say, this is what you need to do, which I'm really excited to go deeper into that, if I'm understanding that right. And
Yeah,
so,
I mean, I could give you an example there. There was a really
yes.
good papers done probably a handful of years ago, and probably goes 10 years ago at this point, where it analyzed a group of students who were just having reading difficulties. They were all they knew was that this individual, and they just took 30 kids in a classroom. They said, all right, all we know is these individuals are reading X amount of levels below their grade level. So then they took a couple of different customized approaches into how they did it. They put one category in where they looked at and they applied no differences in their training. And they said, all right, if we look at eye movement analytics and these saccades, if we're looking at them saying, or if they're going to jump from word to word to word, if their ocular motor approaches are inaccurate, then they're reading the same line twice. They're skipping lines. So now their reading comprehension scores, of course, are going to be poor because they're not even getting the whole story. So when you're asking, where did Spot run? You're going, who's Spot? If you're looking at it from that way, if you can't read accurately, then that's going to tank your read comprehension scores. So those individuals were given certain eye movement criteria, just generalized ones, and put over here. The other ones who were having the reading comprehension issues, they did other types of classic maneuvers that were more customized to them, and they were put in their category. In the end of the 30, everyone jumped at least 3 to 4 grade levels, and all they did was do this for 10 minutes a day for 2 weeks. But it's taking that customized approach and realizing the kids sitting next to you, maybe their exercises aren't going to work for you. You're both struggling in reading, but for vast different reasons. It's all customizable. Once you understand what that person needs, I mean, sky's the limit.
So good. And no, I love that approach because it's so, like you said, individualized, personalized, customized. Like that's, I think, what people need. I think this like one size fits all we've seen for so many reasons just doesn't work well. So man, I'm loving this. I'm curious if there's any typical neurological dysfunctions that are associated with emotional trauma. And I know, we're talking to an audience obviously who comes from, broken families, traumatic family situations, whether it's high dysfunction, like I mentioned, or divorce. So I'm curious if there's any kind of typical telltale signs, symptoms that come up neurologically for someone coming from that background.
That's a great question. That's where, although it's customizable and similar, there are some patterns that certainly follow. Now, there's certainly types that, this one's going to be the anomaly, but a lot of times, and what's interesting is, and I've been fortunate to do a lot of recent studies with this and see a lot of recent patients on this in the last few years, where patients who have gone through traumas and not just relationship traumas have very similar mimicking of areas of the brain that aren't working and responding so well as those who were adopted, and a lot of them adopted from other countries who either had unfortunate past histories that they may or may not know, and are in phenomenal loving families currently, but have similar areas. And one of the areas that we're noticing a lot of times is not only these back areas of the brain in this posterior parietal cortex that's giving these responses, or should give these responses into time space relationship. I mean, this is where Einstein was very good in seeing those extra dimensions that you can't see through the naked eye, because it gives you an interpretation of self versus world. Well, that would definitely be skewed if, again, you're analyzing a situation with yourself, a relationship, a newly adopted parent that is, you're perceiving as a way from before because your subconscious wasn't working so well. And some of the others are these almost perseverations or these windups in these areas of the frontal lobe, in the areas of executive function, mainly up front, is Prodman's area 11. It's the orbital frontal area. And that's like your gatekeeper to the emotional limbic system. So that would be you're about to have a emotional response, happiness, sadness, and it's going to pass through this orbital frontal area as well to give some of these action commands to these much deeper areas in the brain. Well, if those areas are overworking or working a little bit slower than they need to, then the response is skewed. And what's interesting is we've seen a lot of patients that, especially from adopted families, that still have their primitive reflexes, which should be attenuated, by 2.5, depending on the type of reflex. Some of them are gone by 6 months. Some of them last 2.5 years, possibly. We have some patients that I've seen at 13, 14 years old that still have these primitive reflexes because these areas of the brain in the front haven't developed because of these areas of perseveration, that these areas of the frontal lobe are working well, but these areas are super deficient. All of a sudden you address these and you say, well, of course they can't make an appropriate decision, and they have these very odd behaviors, or they act immature in these other areas. Then it's because those areas in the brain haven't developed well. And so, like I said, a lot of it's that area that gives you that current time-space relationship. Where am I? Where's the world around me? Because you can imagine that's going to be very critical if you're going to analyze an environment. And then these other areas are also heavily involved with not only emotions, but emotional memories is the key one. And those areas quite often are deficient or lagging behind in the development. And we could address those, non-invasively, pretty successfully.
So fascinating. One of the things in the research that I've seen is that the biggest area of life that's impacted when your parents get divorced, in particular, is your own future relationships, especially your future marriage. And I'm curious kind of how I have my way of interpreting that as like a layperson and someone who's been through that. I'm curious how you might interpret that neurologically, in addition to what you've already said. Why is it such a struggle? Why is it such a struggle for, like one of the ways I articulated in college was, it was like, man, it feels like my relationships, my dating relationships in particular, are just like so much more difficult, so much harder than my friends, from what I'm hearing my friends say who come from maybe healthy, intact families. And so, yeah, it was always baffling to me. And marriage, in a lot of ways, has been a challenge. And we've worked through things for sure and are in a better spot. But we've seen that trend, and I think that's why so often, it's this cycle that repeats itself. Like we talked about before recording, is that we end up coming from these broken families, and we don't really know how to build healthy relationships, and we build unhealthy relationships, which leads to broken marriages and broken families and this whole thing. So I'm just curious, like from your vantage point, people have heard me talk about it, but I'm curious from your vantage point, like why do we end up repeating that, and what's going on like below the surface that we don't maybe talk about?
Yeah, well, if you can imagine that, and that's point two, and also some of what we talked about on camera. If you look at, the rates now, especially of divorce, and you look at the difficulties in relationships, and certainly social media doesn't help in their perceptions of they feel an appropriate relationship is, and the higher numbers of even open relationships, which is it's a whole nother box of whatever's. But if you look at as that becomes normalized, you have to look at some of the other areas too of one that's a massive subset of population that's definitely going to be needing care. But in that interpretation of it, you're at most times, not always, but there is a product of your environment. But if you can imagine, if you at a young age or whatever age you had relationship difficulties, you have to make sense of it, because again, you have to be able to survive the next avenue. You're still a living organism that has to adapt. You don't know if it was because of a trauma or you stepped on a landmine. The reality is a negative behavior occurred, and thus you have to make sure that you can analyze those things differently. Well, now I know what a landmine looks like versus now I know what a bad relationship looks like and what signs to look for. So these areas have to adapt to it. But if you look at it from like there's what we consider plasticity versus negative plasticity. And for those who aren't either heard of the terms or aren't quite sure, plasticity is that ability of the brain to make microscopic connections between other areas of the brain. When they talk about like muscle memory, the muscles don't remember anything. It's these areas of the brain and the motor cortex that are able to produce much more hardwired pathways to make that type of movement more efficient. Well, there's plasticity, good thing, but you could have negative plasticity where you have, a wind up where all of a sudden you see something, and all of a sudden you develop a stutter, or you see water on the right, and all you think of is, well, don't block it right, and you start pulling them left all the time in golf. Whatever those movements are, you have adapted avoidant behaviors. So if you're not able to fully address what the reasons are why you don't quite have something, because maybe you were exposed to your parents doing something that you didn't know, or all of a sudden you just think, are all relationships going to end in divorce? I thought my parents loved each other. Whatever those things could be. If you aren't not only necessarily even to make sense of it, maybe you feel like you made sense of it, but these areas in the subconscious, are waving their fingers saying, no, you didn't. You have these avoidant behaviors, and because of that, now you develop these negative plasticity, and now your whole world and adaptation is a consequence of just something that happened in the past that may or may not have even directly affected you, but now it has. So that's some of the things that occur. But again, when you look at it and being able to make sense of it through combination of trauma therapy, functional neurology, there's even been great research coming out in the last few years from Harvard and some of my colleagues up in Canada with psilocybin mushrooms, and looking at those areas and psychedelics and being able to hit these areas in the limbic system and frontal lobe, all these different avenues that could be addressed. You can have an ability to look deeper within and make sense of those things, because otherwise you do develop the avoidant behaviors, and yeah, your successes in the relationships are probably going to be diminished because of it.
So good. I want to make sure I understand this, and I'll just kind of give you a little bit of a read back. And what I'm hearing is that we kind of subconsciously and even like neurobiologically pick up patterns in life, patterns of behavior, ways of treating people. So if like our parents are, like one of the things I observed growing up, and my parents would be the first one to tell you this, is they just didn't handle conflict very well. And so, they would argue, things would get loud, and then one or both of them would just kind of walk away and nothing was really resolved. And so for me, going into relationships, I felt like, my goodness, I really have no idea what I'm doing when it comes to conflict. It feels really scary. It's a lot, like you said, easier to just kind of avoid that and tiptoe around and not talk about maybe hard things. And so on a brain level, it sounds like that's just kind of what my brain learned to do, and that it truly can be rewired. But like you're saying, we need to first kind of go to that place of, okay, this is what I learned, and then this is kind of how I'm dealing with it now, and this is what maybe I want to be doing in the future differently. And that muscle memory, like you mentioned, just like with swinging a bat or a golf club or a hockey stick, like we can train our brains even in relationships to do things differently too, which I think is super hopeful. Because what
Yeah.
I've seen a lot with this audience too, because me being one of them, is I think, can feel really hopeless. We can feel really helpless. We can feel fall into kind of the whole victim mentality thing of being like, well, I'm kind of screwed. Came from a really messed up family, broken family, never really saw a healthy relationship. I have this maybe slew of unhealthy relationships that I fell into. I don't know if I'm capable of even building a good marriage of, and all that. And so I think it could lead to this dark space. So this is just very hopeful even.
Yeah, no, it's incredible. You have it not only from personal experience where you go, oh, this one didn't work out. All hope is gone. No, it's not. No, it's not. It's not at all. In fact, you probably are going to gain a whole lot more from it if you have an ability to look at why that one didn't work out. Now you have an entire, new line of questioning or adaptation to apply to it. I'll be the first that, that didn't always work always necessarily for myself and some of my friends and family around me. But now when you can look at it from a different approach, and it maybe isn't instant, but if you have those resources around you, and not necessarily solely just a functional neurologist, but those friends and family around you that you could bounce the ideas off of, if you're given a better blueprint as to what to ask and realize that, okay, given this environment, what can I do next, you have a much better chance of success than not addressing those things and instantaneously just bottling it up and go, oh, that's it for me. It's
Yeah.
not. It's not.
Beautiful. I love it. So inspiring. And I want to get a little bit more kind of nitty gritty in terms of if someone were to come to see you. Like imagine someone's listening right now and they want to make an appointment with you and they were to come and see you. Like what would that look like? What would the first appointment look like if they were to tell you like, yeah, even like especially with this audience, I come from a broken family. These are my struggles. I have emotional problems like anxiety, depression, loneliness. I, maybe have behavior bad habits in my life. I have, relationship struggles like we were talking about. Yeah, what would the first appointment look like? How would you assess them? I'm curious, kind of the whole 9 years.
No, that's a great one because when you hear functional, you go, yeah, well, what is it? What do I do? What are you actually doing here? This guy talked about PTOT, balance this person's falling off a cliff. With functional neurology and what the first appointments look like, generally, I'll do a screening first and have a conversation with the person just to make sure I understand what's going on. I don't need a full detailed history and any of that stuff. I want to first understand, is functional neurology going to work for this person? Because there might be a population where it's necessarily not, and not always the case. But if they are under maybe certain medications that they have to come off of, or they're hospitalized currently, and those things, or we've been fortunate that we've seen people in comas and locked in syndrome, so you are not limited by what those are, but we just want to make sure that, is this going to work for you? And to be honest with you, the majority of the patients that it works for are ones that it's open for. If you're coming in and you really have no want or desire to improve, one of the things that makes functional neurology somewhat limited is the fact that it's also limited by your ability to get to appointments and work together on those things. And there's home exercises, but not as complicated. But that first appointment after the screening, we say, okay, yeah, this is a case I could help. This is something. This is working. We could work with these areas. Your first appointment is combination of almost an interview, a history of what's going on, a lot of question and answer back and forth, followed by, it's a pretty detailed physical exam. I mean, it's usually hour, couple minutes longer, or more. I mean, we've had some 2 hour exams, 3 hour exams. We've had some that are, half hour. And what we'll do is we're going to analyze those sentences. We're going to look at a few different pieces of technology. We're going to do some bedside exams. We're going to do the classic finger, nose, finger. We're going to shine the light in the eyes and look at pupil responses. But we're also going to do posturography and balance testing. We're going to look at analysis of eye movements from tracking targets, pursuits, jumping from target to target, saccades, optic kinetics, vestibular reflexes in all different planes. Because again, we're looking at for the intricacies. You're telling me maybe you're having relationship difficulties, or you're having trouble with balance or back pain, or you're having trouble playing your sport, or you have a tremor. We're just looking to figure out, okay, where's the breakdown that's causing this output that we don't need so much. And we're looking at those senses specific to you. We might have these general platforms that we're looking at the eye movements, the balance testing, the pinwheel sensation. We're looking at the autonomics. We're looking and listening to the heart rate in different various positions, and we're doing a pretty detailed examination. Like I said, it's going to take sometimes an hour to 2 hours, quite often, but that's going to allow us a big picture to figure out what areas in the brain are working well and which areas need addressing, and what does that have to do with what you're here for. Then we create that customized plan specific for you. And the way I work and research has demonstrated to be the most efficient. And also due to some of the schedules that we all have, the way we generally have worked with is an intensive model, which means to say generally you're going to see me 3 times a day for 3 to 5 days. And your first appointment's going to take that maybe a couple hours, a little bit more into the analytics and figure out what's going on with you. And then right when you come back in, we're starting that treatment plan. And that's, again, that combination of whatever you need. It could be a catered version of a vestibular or vision therapy, some of the balance training, some of the movements and the fine tunings. I mean, some of it is, I've had PT before, OTs. You have, and we're using that as the blanket terminology, but we're applying it specific to you for what these reasons are in combination with many other areas. So you're having that next appointment, generally that's, we'll say, an hour, a couple more hours off, and then you're coming back that third time. And we're just repeating those treatments then for the next few days and making those micro changes based off what we see. Because before and after each exam or our appointment, rather, we're looking at, okay, where are we at? Where do we need to make those adaptations? Because if we're doing something, if I move a patient's head in vestibular rehab, I should be able to retest some of these areas in the eye movements or the balance, and I should be able to see a micro change. And if we're seeing those changes already, instantly we know we're on the right thing. If not, then we need to change that exercise right away. So before you even leave that first appointment, we have a pretty clear understanding of where at least we need to start with your exercise. It's not guesswork. It's not, oh, you have a concussion. Well, this is what we do for concussion. I have no idea what we're going to do with you yet. I have no idea what you have. I have no idea what we're going to do, but we're going to figure out now specific for you. And that's how each appointment works. So generally you're with me for, 3 to 4 hours a day for at least 3 to 5 days. We do that pre and post measurements. Then at about 90 to 95% of cases, we're at or exceeded whatever the goals were for the week. That's one thing we also do is keep a lot of stats on from sleep performance, which is one that's always been a residual that I've only ever had a handful that have come in for sleep abnormalities, but generally sleep is affected because these areas of the brain not working so well. But we're tracking sleep, we're tracking the heart rate and rhythm. We're looking at sometimes for some people their blood work pre and post. We're looking at all these intricacies, and now we're able to make some pretty substantial gains in a small window.
Yeah, that's incredible within 3 to 5 days. And I imagine you're kind of like setting the body and the brain up on a path to continue healing itself too. So it doesn't just stop past the 3 to 5 days and then someone comes back for more, but you're really trying to, from what I understand, keep the body going forward. Is that right?
100%. I mean, for no reason. Then when you first told me your name, I still remember it. That was a pathway I didn't know. That was a stimuli I didn't know, and all of a sudden, well, now I know this person's name, and I can remember that going forward. It's that same concept. We're just applying it to, well, this person had a tremor we want to make a little bit smoother. This person has some balance issues we're trying to improve. Just by increasing and changing the stimuli in the brain, you're making instantaneous adaptations, but we want the adaptations to be, in the direction where it's more symmetric and more appropriate versus, that negative plasticity. And they hold. And we still give you exercises to do at home for X amount of period of time. Again, that's all part of the whole process and catered to you. But Now, because of that, we're having a plan specific for you, and we know it's going to stick and hold. And in those cases where you have a degenerative condition or a neurodegenerative condition, Parkinson's, Alzheimer's, well, if we know the trajectory is going to be downward, if every so often we can recommend you come in for a boost, if you plateau in a condition that the trajectory is downward, that's an improvement the way I'm looking at it. But for all these
100%.
other cases, if you're down here, we can give you these boosts up and you're not going to come back down because, these other conditions are not, necessarily neurodegenerative. They can be if they're not addressed, though. So by addressing them and getting you back on the right path, I mean, we're stopping the probability or minimizing it that we can have a lot more of these other things down the road. Like we look at, multiple head injuries and have a sevenfold increase of causing Parkinson's or Alzheimer's, but if that's non-treated, for treating those, we're much more minimizing the risk of that. And that's what we're trying to do is not only help you for now, but how can we continue to set you up for success down the road? Because in plenty of times, we can exceed your goals. And now it's okay, well, what else do you want to work on? We got that. So what else do we need? If we need to come back down the road because now you want to, have a new performance goal, we're all for it. But otherwise, what else can we do for you? Because you're not just limited by, and we want to keep your balance. We want to get your eye movements there. What are some other things that's carrying over your daily living or your relationship issues and the other thing is too, how else are we working in conjunction with your providers back home? Who else do we need to work with in this? If that's the case, we definitely co-manage with, like I said, in our clinic, functional medicine and trauma therapy. But if we need to do additional things, we're always open and always for it. And that's, again, it's creating that catered plan for that person.
Makes so much sense. And I love that approach, like how you can have those touch points in the future if you need them or want to improve or prevent a bad condition from getting worse. But you're not necessarily signing up for life. I had a friend recently tell me that he was having some back problems and he wanted to go to a chiropractor, but he was like, I don't know. He kind of felt like he was going to be signing up for like a life of adjustments, like a lifetime of adjustments. But he went to a chiropractor who sounds like really competent, and the chiropractor's like, no, we'll do 2 adjustments and you should be good to go. So I love that approach instead of like, being needed to pop a pill for the rest of your life or something like that, which not putting people down who have a condition that needs
Oh,
that. But I love this approach better. And no, so good. And on that note, just curious if you have any success stories of patients you've worked with who maybe were in this one condition and then they worked with you and then they were able to improve and be in this better spot in life.
and I've been quite fortunate to work with a lot of different, I said from athletes to average paint, but let me think. I would say the best one I'll give it was a week that was pretty impactful for me, and I was working in a clinic and I start in Florida where I generally see 2 to 3 patients a week, which is kind of how you do it once you average out, how many patients you're working with. If you're doing an intensive thing, I mean, you're out with your 1 hour a day, 3 patients automatically is, 10 hours, not just of your own time, which not opposed to working the long days, but for the patient now, someone's coming in at 7 a.m. and not leaving until 4, right? So, we limit to make sure that it's also comfortable for patients. But in one particular week, I had an individual who was, I'll just say, ejected from a car after being hit by a train. Was found in a tree pretty far away, and he was a younger kid, an athlete, and he was in a wheelchair, couldn't walk. I mean, you would never know talking to him that there were any abnormalities. The fact that he's in a wheelchair had no vestibular postural tone. So that was one. I had another patient who was a Fortune 500 CEO, perfectly healthy, perfectly functional, but had a fear that he was going to lose his job because of, if the next kid coming up can do everything in 12 hours and can make faster decisions, the board's going to love him, especially if he's going to do it for a little bit cheaper rate. And all of a sudden he's worried about, working 18-hour days and burning out and, his health's tanking because he's inefficient in some of his decision making. And we're looking at it from you check the boxes. No person really in the medical community would. I mean, you could Google this person, find him in seconds. You go, what? There can't be anything wrong with this person. He's one of the richest in the world, and there's no reason why there should be abnormalities. What's he here for? And then on the other end, we had another person who was a professional athlete, but had a fear of retirement because they were concerned that in this last year, if they didn't have their performance goals the way they needed to be because of some recent head injuries, that they weren't going to play again. And unfortunately, we're going through some mental health issues because of that. And also some of their head injuries, we know, unfortunately, can cause a lot of these mental performance issues. And now they have not only the PTSD, but massive increases of anxiety. So you have three completely different patients that all went through the very same program of what are we here for? What are your goals? And the Fortune 500 CEO, he reached his performance goals and was able to drop his workload. And this is an individual who was drinking 4 pots of coffee a day down to one, and working 18 hours a day back down to 12 to 14 hours, more efficient. Stock prices, stockholder value all looks good. The next individual, the hockey player, not only was able to get a great contract year, some of the suicidal ideations completely dropped. His relationship was improving because there was a fear of divorce in that one. And also, we have now a person who, went on to have a very successful and probably, no, definitely an all-star career, but probably even a Hall of Fame career. And then this other individual who was, hit by a train. Not only was he out of the wheelchair, but he walked out of the clinic on Friday.
Wow.
So now you have three completely different cases that are all being treated by functional neurology just by being able to look at the brain and analyze it and realize if these areas are deficient, three completely different systems. Although actually you could argue that, their motor systems or their emotional systems were all taxed, but their treatments look nothing alike. But the approach in the beginning was very similar. It was just start with a clean slate and apply it as need be. And that was, to be fair, it was kind of a typical week of just it's those types of success stories I've been fortunate to have, because the foundation, my colleagues laid out and did a lot of groundwork and improvements in diagnostics and everything. And very fortunate to be not only at the cutting edge, but really on the receiving end of it. That I wasn't. I was only involved in the creation of a couple pieces of technology in my career, but I've been able to really stand on the shoulders with a lot of them that have laid a great foundation and education, and just fortunately taught me how to apply it in a way that allowed for a lot of this. So kind of also shows that once again, it's clean slate, everything's catered to you, whatever you need. It's you're not alone, number one, but you're very unique, but you're not unique to the sense that you can't be helped.
Yeah.
We've probably seen it before, and these areas of the brain exist. And if you know how to look at it and understand it, you get a pretty comfortable environment to where you can use the technologies or everything so basic pretty quickly.
Wow, incredible. Super inspiring stories, amazing results. And I want to ask you a million and one questions, but a couple of final questions before we close down here. For the initial assessment, like if someone was thinking about doing this therapy tomorrow, I'm just curious on the cost side. You don't have to give maybe your specific cost, but generally, if they were to go to a functional neurologist anywhere in the United States, for example, what would the ballpark cost be for something like that? And does insurance typically cover it?
That's where it gets complicated, but not in the in other countries. Sometimes we're dealing with some of the socialized medicine. There it could be covered, but the wait times could be long. So it was interesting enough. I saw, still to this day, I've probably seen more patients or very similar from other countries in the United States, just because they were generally looking for that holistic approach, but weren't able to access it because their own government limitations. In the United States, we can get access to it, but payment gets a little bit limited.
Yeah.
Insurance will cover some of these things. A lot of times, though, it's very dependent upon the why and everything. So a lot of the diagnostics are not covered by general insurances. They will, but they pay a small portion of them. And then a lot of the other clinics, especially when you're doing intensives, the way insurance billing works, you can only bill for one type of those services per day, and then you're usually limited by how many times per week. So with all that being said, a lot of the functional neurologists, and even that's why a lot of the functional medicine docs in those areas are cash driven. And I promise you, it's not solely for lucrative value. To be candid and transparent, it's just because of the fact that you can give a lot more to a patient by charging certain rates than you could by insurance. And actually, we've done a cost
100%.
analysis of it where we've looked at, what's the average person with concussion,
Mm.
because that was a higher population of patients. What does the average concussion cost a person? And we were able to see about 250 to 260K between your years of lost wages, job performance, things of that nature. So when we're looking at paying fractions of that for 3 to 5 days with the success rates we know we've been able to have, and somewhat of it, it's almost no brainer, at least when you look at it that way. but it is still a cost.
Wow.
Costs fluctuate, and they're dependent upon each individual one. But I would say probably your average intensive treatment, I would say, would probably range from 3 to 10,000 for a week, if I was to put a number on it and just be
Ballpark.
fair.
Yeah. Yeah.
But everything is dependent upon where you go, what the locations are, and availability and everything. But I
Yeah.
mean, when you compare to what the average cost of some of the other areas, and your insurance premium is going up, it actually is much cheaper. It's just that majority of them are generally cash based for that reason.
Yeah, no, it makes so much sense. And no, the investment side of it is wild. I think a lot of people only sometimes will only think of what they're giving up, but man, you get so much out of it.
Yeah.
And like you said, when you do the analysis of like maybe being able to make more money and being able to just live like a better life, that investment, especially looking at the way we use our money now, it's like, well, I spend this on that car, or that thing, and it's like, is that really making your life better, adding a lot of value to your life? And for honest, it's not. And so things like this, I think, are compared to that are wise investments. So that makes sense. And are you able to do like an initial assessment with someone without committing to the intensive, or is it kind of a all or nothing model?
No, no, absolutely. The way, and we're just like this, we talked about before, creating a catered program to them based upon their condition. What we see on exam, we still base it upon their schedule as well. Now, generally, I travel and have a few different jobs between the U.S. and Canada, so
Yeah.
around. So I have worked, but I also work in an intensive environment just because of the fact that it's created a better success rate for patients for that population.
Makes sense.
However, if we're going through an analysis, and again, everything's very transparent. If we do an exam and realize, I don't think we're going to be able to help you, this would be more appropriate. Or I know we originally talked about setting aside 5 days, but maybe 2 or 3 would be more beneficial. Then we're very transparent with that. That's what it is. Or if we're at day 3 and we think, look, truthfully, we can knock this out of the ballpark 2 more days, and we have those conversations. So you're
Yeah.
not automatically contracted into just because you picked up the phone and talked to me, or anybody or other functional neurologist. They have to see that you're automatically locked into those treatment plans. Everything is very individualized and catered, so it's working by the schedule. And in the cases where
Right.
you do have a schedule where you can't do an intensive mono, there's always ways to work around it. Things just might take a couple more weeks or months, but it can always be worked and catered to you.
No, it's really helpful. Thanks for going through all that. And for anyone who isn't aware of this, I've have friends who work in the medical world and work at clinics and things, and um, dealing with insurance is like a job in itself. And so that this movement towards like cash payments is really wise in a lot of senses, and actually can lead to a higher quality of care, because you're not dealing with these insurance companies and fitting into this box of like, well, that's not a diagnostic that's like in this 50-year-old manual or whatever the heck it is. So anyway, it's exciting to see kind of where this field is heading, and I'm really interested to learn more, and maybe I'll need to do some treatments myself, which is awesome. So I did want to ask you if there are any like maybe common myths or misperceptions, misconceptions of this field of functional neurology.
I think some of them in the beginning, I would say the beginning, some of them say it's an instant cure all. I'm going to be done in 2 days because he said he got that person on the wheelchair. That's not every single case. Although to be fair, it's a good majority, but that's not every case. And you should never go home thinking, I know this is going to be a guaranteed home run 100%.
Yeah.
Nothing is ever that way. And if anyone gives you a guarantee, you should run pretty quick. But one of the other things that you should look at, I think, which is a misconception of functional neurology, is that I think a lot of them will look at, especially from the medical community, some of the original papers that came out, trying to bash it as a placebo or things of this nature.
Yeah.
One of my founding member, Dr. Carrick, said on Connie Chung, if this is placebo, then we're doing a pretty good job at it. But if you're looking at it from that sense, one of the things that sometimes are the misconceptions are that, I've been to PT or I've been to OT before and it hasn't worked. So what's different about your vestibular technique versus this and that? And it's not a comparison of one versus the other, but in the sense it's the application of it. When you're catering a program to you specifically and not just your condition or your limitations of insurance, then you have as many options as you want, whatever you can create. And we're not short on technology. We're not short on space and ability to do those things, so we can create an environment for you. I mean, we've taken athletes onto their field of sport and designed therapies around there where, okay, maybe we're trying to do these types of eye movements from this direction, left to right. Okay, well, you don't sit in a desk all day, so we need to create an environment for you. Okay, we're going on the ice, we're going to the football field, we're going to hit baseballs and stuff. You can create it for you. So because of that, again, when you're not bound by the limitations of different insurances, environment, or technology, then everything for you is different. So just because you've been to one technique before, you tried talk therapy and it didn't work, you are not alone. You are not bound. You're not stuck. It's not over. I promise you, there's plenty more stones to uncover and a whole lot more resources available.
Good stuff. If someone wanted to work with you, how would they get in touch with you or maybe another functional neurologist in their area if you don't serve that area?
Yeah, of course. So for myself, I'm always open. You deal with me. I'm kind of the one-man show for that one. Work for a few different companies in neurology and neurotechnology. And as I mentioned before, even a psilocybin mushroom company up in Canada. But if you want to get a hold of me directly, I'm always open. You can just email me, Dr. Link, Link 18 at gmail.com. That's me. Anytime you have a consult or you have any questions about navigating the system or finding a provider near you, always open for that. There's two other great resources. I'm sure they won't mind if I share. There's
Please.
ACNB, American College and ACNB, the American Chiropractic Neurology Board.org, and ACFN. There's two different ways to sort of become a functional neurologist. There's the diplomate and the fellowship avenue. And both of those options will give you a list of doctor locators near you in not only the United States, but other countries as well. So you'll be able to find a functional neurologist near you. There's also the last one, no financial connection. There's also the Carrick Institute website is a tremendous source and resource for you to be able to look up and not only learn a little bit more about functional neurology, but not just and patients, but also if you're a provider, want to get a little bit more information on courses or what I can do and how can you learn a little bit more about eye movements. They're incredible. But honestly, I mean, 24/7, if you ever want to reach out to me, emails, some of the easier ways. And I'm always open to have a conversation about, would you be an appropriate patient of mine? Can I help you find a neurologist near you? Would be more than helpful to be an advocate for that, because I think one of the things is, service back to humankind, as Dr. Carrick always said. So I think we should always live by that. So if anything is never stuck or you have a question, need a resource, always happy to be that.
Really appreciate it. Dr. Paul, you're the man. It's been great learning from you, and I'm excited to see where your practices, your careers, all the companies you're involved with goes. And I know there's really amazing things ahead. So I'm glad that you're able to come on and speak to our audience, and we're better for it. So thank you so much. I wanted to give you the final word. I'm just curious, what final advice or encouragement you give to everyone listening, especially young people who come from broken families or maybe feeling broken and stuck in life? What's your final advice?
Final advice, and I could speak, truthfully on this one, is you're not alone. Quite a lot of times that you feel as though you're stuck and, you're in the, woe is me. It's always going to be this way. It's never going to change. You realize a lot of times that the people around you that you thought either didn't care so much or maybe didn't quite know, a lot of times they're great resources. But maybe you can't always find that professional. Maybe you reached out to, a therapist originally or a physician. It didn't work well. It doesn't mean that it's always that way, and doesn't always necessarily mean that I'm the right fit for you. I mean, if you don't want to hear things in a Canadian accent, I'm probably not the person for you. But if you reach out and you realize that there's a lot of people that are resources, a lot of times they're closer to you than you realize, and they also went through similar things that they don't even share, and they found resources that they clip close to the vest. That once you really get to talking, you realize you have a lot more in common than you realize, and you're going to be able to see those resources come to fruition pretty quickly. So I promise you're not only are you not alone, but there's also a lot more hope available rather quickly than you realize, from not only functional neurology, trauma therapy, functional medicine, and any of the classic avenues. Honestly, this podcast, looking back, you have a tremendous resource here that if you look at the divorce rates, the rates of failed jobs, the marriages, the changes in economy, there's a lot of struggles out there. There's a lot of resources available to you right now. Take full advantage of them, and never be afraid to reach out. And that's how I would end it after a truthful thank you for allowing me to come on, and also more so thank you for all you do in creating this, and starting what you thought was going to be sort of one environment, and realizing the outreach that you have is a great example. Like you're reaching a tremendous vast audience that you thought was going to be this one subset population. Now you're out doing that. So thank you for all you do and bringing this together as this resource.
If you come from a divorced or broken family, or maybe you know someone who does, we offer more resources than just this podcast. Those resources include things like a book, free video courses, speaking engagements, a free assessment, online community, and so much more. And all of our resources are designed to help you heal from the trauma you've experienced in your family and build virtue so you can break that cycle and build a better life. And so if you want to view all the resources that we offer for yourself or maybe someone that you know, you can just go to restoredministry.com/resources or just click on the link in the show notes. That wraps up this episode. If you know someone who's struggling from their parents' divorce or broken family, feel free to share this podcast with them. Feel free to even just take 30 seconds now to message them. I promise you, they will be so grateful that you did. In closing, always remember you are not alone. We're here to help you feel whole again and break the cycle of dysfunction and divorce in your own life. And keep in mind the words of C.S. Lewis, who said, "You can't go back and change the beginning, but you can start where you are and change the ending."